Good evening. We are live at 7 o'clock. I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight, we have a doctor, you'll recognize her, from North Shore University Hospital to help you sort through what's going on with COVID-19 in our communities and across the region. This is a call-in show. We definitely want to hear from you. Call us at the number at the bottom of your screen. It's 516-393-1800. Well, New York State is making progress in the fight against the coronavirus. The governor says hospitalizations are declining, but more than 1,000 people are still testing positive every day. Statewide, there are more than 270,000 confirmed cases. Those are just the confirmed ones. Across Long Island, more than 63,000 infected. The death toll, staggering numbers statewide, 16,000 plus. You see the numbers right there. A little more than 2,500 of those deaths are right here on our island. All right, let's get right to our discussion. Joining us from is Dr. Evelina Grayver, who is, as of today, is the Director of Women's Heart Health at the Sandra Atlas Bass Heart Hospital at North Shore University Hospital and Long Island Jewish Medical Center. Congratulations on your promotion. I know that takes effect today, so congratulations. Thank you again for everything you're doing. You're one of the essential workers right there on the front lines. Let me start, as I do every night. How are you holding up?
I'm doing well. I'm doing well. Definitely. Thank you so much for acknowledging the promotion. I appreciate that. It's been really a tough couple of weeks, especially since the last time that I spoke to you guys. But we are beginning to see some improvement, which gives me, and I'm hoping to give you guys, a lot of hope.
Yeah, that was going to be my next question. I know the governor is saying we seem to be on the decline, but the numbers are still pretty staggering. I mean, it's hard to imagine that. I mean, each one of those numbers is a human life. Are you seeing that also, that we may be going back downhill?
We're beginning to go downhill when it comes to sort of the admissions on the regular hospital floors. Unfortunately, the admissions into the critical care units are still significant.
Okay, and we're hearing, I mean, we don't have a vaccine yet. We're going to be moving into fall without a vaccine. Can this also be complicated when we move into flu season?
Absolutely. I think it's going to actually complicate things a lot, just because even from the diagnostic standpoint, when patients come in, we're definitely going to be quite concerned as to whether or not this is the flu, whether or not this is the COVID, what it is. And then we also have to understand the fact that these viruses are way smarter than all of us, and that there's a huge chance of potential mutation and a new component of COVID that might not even be covered with this vaccine.
There seems to be a lot of confusion out there. Different states have different timelines of when they're starting to open. I know the governor is saying he's going to try to make a decision as of next week as to when our schools should be open. Should we be thinking about reopening at this point, or should we keep everything locked down?
I would be the first one to say that I want to go back to, quote unquote, our normalcy more than anyone, I promise you. However, I think that at the current state, without having the ability to have access to a vaccine, without having ability to have access to any regimen that actually works, like as an antiretroviral therapy, I think it is quite dangerous to open up. The government will make their own suggestions, but I think people have to take into consideration the logical component of it, and that is, we don't have a vaccine, we don't have the therapy. So no matter what the government recommends regarding opening anything up, please, please, please be cautious.
Okay, let's see if we can't start off with some calls here. Do we have Gina from Hicksville on the line?
Yeah, hi Mike, how are you?
How are you? What's your question tonight?
Question is, I'm taking the Long Island Railroad almost every day. Can I catch anything on that? I do wear my mask, my gloves. When I come home, I change in the garage. But is that catching, or?
So it's a good question. I think that the fact that you're wearing a mask and gloves is very important. I would also add maybe taking the Clorox wipes with you and potentially wipe the seat that you are sitting on. Make sure the fact that you try not to sit to anybody close. If somebody is showing any types of symptoms, I think that at this period of time, it's okay for you to stand up and to change your seat as well.
Doctor, let me ask you this. I'm hearing conflicting reports, and maybe it's just too new that we don't know the answer to this. Are you more contagious with the virus before you start showing symptoms, or is it after you start showing symptoms that you're more contagious to other people?
All right, so I think that everybody kind of has to, and what you're asking is sort of the timeline of coronavirus. I think that everyone has to understand the fact that we in the healthcare field are learning as the time goes on at this period of time. So what do we know? We know the fact that during the first 3 to 5 days, when you are quote unquote shedding the virus, you might have very minimal amount of symptoms, and that's when you could be the most contagious. So that is a significant concern. So there are people that could be sitting next to people on the LARR without even knowing the fact that they actually might have the virus at that time.
Okay. Is Al from Bethpage?
Yeah, this is Al from Bethpage.
What's your question tonight?
Yeah, thank you for taking my question. My wife suffers from a rare disease called cutaneous T-cell lymphoma, for which we've been to a number of patient conferences. At those conferences, they've discussed treatment for her disease called excorporeal photopheresis, which is a treatment where the blood is drawn from the body, exposed to ultraviolet UV light, and returned to the body. Now, we recently watched a news session with William Bryan from the Department of Homeland Security Science and Technology Division, where he indicated that the coronavirus is highly susceptible to UV light, ultraviolet light in sunlight. We were wondering if we know what the impact of photopheresis is or would be on coronavirus patients, and if not, how do we go about ascertaining the viability of such a treatment?
Tough question, and I like it. So, photopheresis is a very new therapy, very rare therapy. We don't know yet as to how coronavirus will be affected by sunlight. We are hoping the fact that warmth might potentially and heat might potentially make the actual virus more unstable to potentially reproduce. So we are kind of hoping for that. In reference to the UV per se, we don't know yet. The other component that you bring up is the pheresis part, is sort of the clearing up the blood in reference to the virus itself. And one of the actual components that we are looking at and will be looking at research-wise is something called plasmapheresis, where we actually similarly extract patients' blood, potentially exchange it, clear it, and then return it back to the body. It has to do something with the actual formation and the way that coronavirus actually binds to hemoglobin, which is the oxygen-carrying molecules, but we don't know yet enough. And I think that if there's a point that I can potentially make regarding this virus is that we in the healthcare field are learning just in the same rate as the layperson regarding the virus.
Okay, and we should also mention another component of that news conference was also the possibility of ingesting disinfectants. Terrible idea. No one should be doing that at all. That's a terrible
idea. Do not do it. Do not drink disinfectants. Do not ingest anything Clorox-based. Please, please don't.
Yeah, that's okay. Let's see. Joseph from Medford. Joseph, you there?
Yes, thank you. I was just wondering how long the virus stays on different items like wood, metal, and obviously plastic.
Mm-hmm.
Thank you.
So there have been a component that said the fact that on copper it can last anywhere from 3 to 5 hours. On plastic and on cardboard, sometimes up to 24 hours. I think that's important to understand because at this period of time, I know we still have certain packages delivered to us. We don't know who touched those packages. We don't know who sneezed or coughed on those packages. So what I would actually suggest is that if there is a package that's being delivered covered in plastic or cardboard, number one, let it sit for quite some time before you potentially touch it. Open it up with gloves would definitely be of importance. Discarding the actual package and disinfecting whatever it is that you are receiving.
Would you suggest also disinfecting your mailbox every other day or every day?
Yes, every day.
Every day, okay.
Every single day.
How about Ann from Massapequa Park?
Thank you for taking my question. Mm-hmm. I have 2 grandchildren who are like fishes. Is it safe for them to go swimming in a chlorinated home pool at the end of June? And if somebody is asymptomatic, can it be spread to another in the pool?
We don't know in reference to the transmission of it actually in the water. I think that if somebody is in the pool and potentially sneezes on somebody or coughs on somebody, it is the same type of transmission. It's a droplet transmission, so you definitely are at the same rate. We're talking about in June. Again, similar to what I've said before, we don't know how stable the virus is within heat. So hopefully in the warmer weather, we'll have a little bit better information regarding the transmission of it.
Okay. We're going to take a real quick break and have more expert advice on how to keep you and your family safe from the coronavirus. Remember, we want to hear from you. Call us now with your questions at number right there at the bottom of your screen, 516-393-1800. We'll be right back. Welcome back to our live coronavirus pandemic special report. Let's bring back in Dr. Evelina Grayver, who is the Director of Women's Heart Health at the Sandra Atlas Bass Heart Hospital, North Shore University Hospital, and Long Island Jewish Medical Center. As of today, new promotion, so congratulations again.
Thank you.
Before the break, we were talking about certain treatments. I know that we're waiting for the antibody testing. Is that something that you are hoping might be a game changer if we can see who might have the antibodies?
Yes, I actually, on the personal note, I was actually hoping the fact that I was going to be carrying the antibody, being as exposed as much as I was. Antibodies would be great to know. We would know as to actually who's been exposed, whether or not there is immunity. We don't know enough yet about what those antibodies will mean, meaning the fact that we don't know how long the immunity will actually last, and what it will mean whether or not if the virus actually does mutate. But yes, people have to be actually very careful because there's a lot of home tests, home kits regarding potentially the antibodies. We don't know how truly specific those kits are. So there are a lot of people out there that actually have been positive for coronavirus, but are testing negative for antibodies. And we're not really sure how to appropriately interpret that.
Okay. And if you do have the antibodies, you can potentially give blood, and that can then maybe go to the plasma.
Absolutely. That would be would make you a great candidate for donating for convalescent plasma. Yes.
Okay. Back to the phones. Peter from Rocky Point. Peter, yeah?
Yes, I have. This is a question for Dr. Grayver. Every year I always get the flu shot, and I was wondering if the flu shot, there will also be another vaccine for coronavirus, and would you need to take both? Thank you.
Absolutely. So the flu vaccine does not and will not cover the vaccine yet for the coronavirus. The flu vaccine will just cover all of the strains of the flu that we are trying to protect against. It will not cross over with covering for coronavirus, unfortunately.
Does it aid you at all if you take the vaccine for bacterial pneumonia? I know this is a respiratory virus, but what about that?
It is, just because coronavirus has been associated with pneumonia. A lot of it is viral pneumonia, but at times patients do develop bacterial pneumonia. Those that are of 65 years or greater should take the vaccine for the bacterial pneumonia, yes.
Okay. Susan from Jamesport. Susan?
Yes, hi. My son had the virus in March for almost 2 weeks. 3 days after his last symptom, he quarantined for 3 weeks. This Tuesday, he was tested again in Stony Brook, and he tested positive. Now, my question to you is, does he need to quarantine again? If so, is it just 2 weeks or longer? Number two, does he need to be tested every 2 weeks? And how long does this virus stay in your body if it does prolong?
So all good questions. So let me start from the first question. In reference to potentially quarantining himself, again, it all depends upon his symptoms. Quarantine, all it means is potentially you are trying to not spread the virus to others. So if he is not symptomatic, then if he's not coughing and there's not droplets all over the place, then he is not infectious. What that test means is the fact that there is still a virus in him. So the first question, no, he does not need to quarantine himself if he's not having any symptoms. Two, regarding potentially whether or not he needs to be retested again, a lot of it depends as to what is it that he does for a living and where does he go and what does that test actually mean for him. If he is completely asymptomatic, then he just wears a mask and really kind of tries to be as careful as possible to stay away from people so that he does not sort of act as a nidus for infection for others. And I'm sorry, what was the third question?
I think I think you covered all of her questions there. Okay. Let's see if we can squeeze in Jerry. Are you there?
I am. Thank you. My question is this. I'm a cancer survivor, also having breast and lung cancer, and I work with cancer patients on a daily basis. Their big concern is the antibody test. Do you recommend that they go and have this antibody test? Some of them have had fevers, which can also come from chemo, and the stress levels of, do they have the virus? Should they be tested? Should they continue their treatments? I really haven't seen a lot of information out there because I understand we're talking about this virus and our immune systems.
Oh, okay, let me try to get the doctor to answer that question just because we're running out of time.
I'm sorry.
So yes, so number one, to clearly answer yes, they should potentially get the test and test for the antibodies. The one other caveat that I will mention is the fact that we don't know what to do with those tests. Meaning if they did have symptoms and the antibodies are negative, it could mean the fact that they have yet to develop the immunity for it, because it takes a while to develop the immunity for it, or whether or not potentially they've never even developed the immunity for the virus or never had the virus to begin with.
Okay, unfortunately that's all the time we have. Dr. Grayver, thank you so much for your time. Stay safe, keep your family safe, and thank you for everything you're doing. And thank you for the callers, and we'll see you tomorrow at 7.